Hi, my name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and welcome to our channel. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Today's video is interesting for the fact that you always hear about this opioid crisis, but we're coming up from a perspective of how doctors are trying to help you. So what we're trying to do is called deprescribing you off your opioids. So you're either in two groups when you're listening to this and interested. You might be in a group of patients where you're like, I am on these pain medications and I've tried to get off of them. I probably started them because I was in a bike wreck and I had really bad neck pain and they started me on it because I needed it. Somehow I've keep taking it because of chronic pain, and when I try to stop, I feel nauseated. I feel flu-like symptoms. I just can't stop them. And then he's going to come up with steps to help you with that. Or you may be another group of patients that he commonly sees where he sees them because they've been going to other doctors and getting all these pain medications, and he's finding out that the amount that you're on is totally not safe, right?
Right.
And so he's letting you guys know why your doctors are always trying to deprescribe you off of these and the steps, again, to help you.
Yep. So let me go over a couple definitions. One, deprescribing is really a definition that describes substituting, reducing, or eliminating any narcotics that you're taking. Now, why would we do that? Well, everybody knows about the addiction issue that's going on nationwide, and it's killing a lot of people. In Missouri, the most common culprits are heroin and fentanyl. Wow. Probably the best solution is what we refer to as prevention. Be very cognizant about what you're prescribing and how much you're prescribing. Now, the amount of increase in prescription narcotics actually exceeds the number of patients who reported chronic pain. So there's something going on there in terms of how people are being prescribed these medications. And I'm not going to go too far into that, but needless to say is that a lot of people are looking at this right now. So let me kind of back up a little bit. Let's say if a patient comes into my office and as Dr. Sue mentioned, they've had some terrible accident, now on pain medication. This is an accident that occurred 10 years ago, and they've been on this medication for a period of time. And so what happens at that point? So you may wonder, it's like, well, I've been to a lot of different pain clinics and all they want to do is immediately take me off the medication. In fact, some patients have come to me because their doctor, for whatever reason, abruptly stopped the medication, which in my opinion is really a terrible way to practice medicine. I mean, if you're going to take a patient off of it for whatever reason, you do need to provide some type of weaning protocol. So if a patient does come in and I'd examine them and there is a reason that I think I might start to deprescribe the medication, here are some of the things that go through doctors' heads. One, if the patient, obviously they come in they want a reduction in their medication. Now they may want this because the side effects, of course. It makes them sleepy during the day. In men, it decreases their sexual function, and it actually decreases their testosterone, which actually is important for both men and women. So there's a lot of bad things that occur with chronic use of medication, these types of medications. And in fact, the more and more research I read, I really can't find too many positive things that occur with people that are taking narcotics in long term. Not that I don't have some of my patients on them. I'm going to go over kind of what I look for when the patients come in. So if the patient comes in, they want a reduction in their pain medication. That's one reason to start deprescribing. The second one is if they're taking a narcotic and what we refer to as a benzodiazepine. That's kind of something like Valium or Xanax, or even a sleep medication like Ambien, which is very commonly given. Or let's say the patient comes in and they're taking what we refer to as in excess of 50 morphine milligram equivalents per day. So what they do is we take the medication they're on, do a conversion over to what would it be if it were morphine, and if it's greater than 50 milligrams a day, we start to think maybe we need to start deprescribing, which means that we either substitute, decrease, or actually eliminate the medication.
What's the normal dose for morphine?
Well, that varies, but in the current CDC guidelines are if they are above 50 milligrams of morphine a day, these are indications for start to deprescribe the medication. I'm talking about chronic pain. I'm not talking about acute pain. Let's say if you have a femur
Oh,
fracture,
okay, that's what I was wondering.
you have a severe motor injury, motor vehicle injury, that's a different environment. I'm talking about chronic pain management at this point.
I see.
So let's say the patient comes in also, they've had an overdose. I see in their record, it's like, well, you've had an overdose. And so whether it was intentional or not intentional, it does put the patient at risk. So I start talking about them about how we're going to deprescribe. Or the patient is at risk for an overdose. Let's say they're elderly, they have COPD and some other issues or severe heart disease and their heart is compromised, and I'm giving them medication that does all bad things to the body. Well, I would start to pause a little bit and say, well, do they really need to be on this stuff? And I've had patients come in on oxygen pleading with me to keep them on the medication. And again, I want to stress that I have a lot of my patients that do very well on it. I do keep them on it. I watch them very closely. But I'm talking about patients that probably should not be on it, as I just mentioned. So what happens at this point? Well, I start talking to the patient about what their functional ability is. So if they tell me I take the medication, but I don't work, all I can do is sit on the couch, and my pain score tends to be really high anyway, I start thinking, maybe we need to start kind of coming off this. And the big question is at what kind of rate do we come off of it as? And I tend to use a rule of thumb. Some people use 10% per month. So I say they're taking 10 pills, they just drop it to 9 for 4 weeks, and then drop it by another 10% for the next 4 weeks. That tends to be kind of slow. Most of my patients, I usually be able to do it by 25% a week. They drop it by 10% per month. That's a very slow rate. I sometimes can actually speed it up to almost 25% per week. I do it very slowly. And if the patient experiences withdrawal symptoms, which are symptoms like a severe flu, and they get very sweaty, and it's just a very uncomfortable feeling, I don't make them go through that. I will go slow down a little bit. I don't tend to go back up, but I tend to slow down a little bit and stop where we're at and let the patient get accustomed to that decreased dose, and we'll slow it down as we go forward.
So you support them through all this.
Exactly. It's very important that a physician, as they're weaning a patient off, support the patient. And the other thing, too, is make sure they have psychological support as well. If patients have just a straight physical addiction to narcotics, these are somewhat straightforward ways to deprescribe. However, if the patient also is exhibiting what is called opioid abuse disorder, so that is really when you start getting into psychological addiction. That means you need this medication to get you through the day. What we're talking about with withdrawal, that's physical addiction, and that's a normal reaction anybody would have when they're on the medication. So I start to slowly decrease, and if I start to see any sign of depression, anxiety, or any other things like I might think this is opioid abuse disorder, I refer them to the appropriate behavioral health professional. It's extremely important. In addition, I assure the patient that we are going to use other techniques as we're tapering off the medication, and they just have to be patient. Initially, the uncomfortableness may be more noticeable at the beginning, but as time goes on, that does get a little better. And our clinic tends to be very patient with these individuals. Now, what other things do we do? Well, I do prescribe, as we mentioned in some other videos, acupuncture. I start to prescribe meditation. Tai Chi is another technique that we use, and there are some other botanical medications that we've talked about in some of the in some of the arthritis videos that describe what botanicals can be used for pain management as well. If I get to a point where I'm stuck, and this happens more often than I'd like to admit, because opioid addiction is very complex, and getting patients off these medications involves a very intensive approach. I start to look to support my other colleagues, and that is some of the behavioral health. I look at physical therapists to help me, and I try to put as much effort as I possibly can. Now, in addition to this, I start asking patients questions about their diet and try to increase their overall health. At the same time, I'm starting to taper them down. This seems to be the best result. I can't say it works with everyone, but I can tell you this is what I'm just trying to provide you what doctors are. Yes, and I'm just trying to give you an idea of what doctors should do is if they're tapering a patient off the medication.
Now, do these Do other doctors like me have to refer to a pain management doctor?
Or someone who's experienced in opioid deprescribing.
Okay.
It doesn't necessarily have to be a psychologist or psychiatrist who deals with opioid psychological dependence, but understands and used to working with narcotics and knowing how to wean them off and what the proper dosing is, how to measure the response, and how to make sure that the patients don't go into full-blown withdrawal, which is extremely uncomfortable. And again, it's a very cruel thing to get to do to a patient. Make sure that they know is that if I need to be off this narcotics, I have to go see a psychiatrist. No,
Oh, okay, that
you
makes
can just
sense.
speak only if they have psychological dependence.
If I'm a patient who now realizes that they want to deprescribe themselves off of narcotics, or they have a family member, do they need to like look in the phone book or look in the internet for a pain management doctor?
No, not necessarily. Your family doctor can actually guide you initially in the first steps. Again, the ultimate goal of any deprescribing is really to improve your quality of life while and minimizing the risks of the medication that you're taking.
I didn't realize how complicated it was. I like that you all provide the support, and it's a team effort to help this patient be successful and healthy.
Yeah. And I do need to include that the failures I've had is when the patients are just adamant, do not want to come off the medication, no matter how I explain to them the risks and explain to them the interaction with the other medications they're taking, and explain to them their quality of life could be better if they're off.
We really hope this was helpful. If you've never subscribed to our channel, we'd love it if you subscribe, and also always hit that little notification bell down there so you know when we've uploaded our next video. Stay tuned to our midweek check-in, which will be about IV nutrient therapy, and you'll actually see a patient receiving IV nutrient therapy in our office. And then the big talk next Sunday is going to be on painful sexual intercourse and what you can do about it. Don't forget to get your tickets at www.healthyyouconnect.com because our upcoming first annual Healthy You conference is coming up. We're so excited. There's a slew of wonderful local physicians that have an integrative perspective to caring for their patients, all the way from psychiatrists, all the way to family medicine, to pain management. So get your tickets and we'll see you then.
Bye-bye.
You're really good at what you do.